Good morning to all of you. I would like to welcome all of you here today. We're just waiting for you. So before moving, and your microphones on mute. And this will make sure that the presenters will not be disturbed while doing the patients. And of course, if you do have any questions, you can use the chat option that is available at the bottom. So once you start sending your chat messages, we can see it on the right-hand side of it. So starting things formally, welcome all of you again and good morning. Today's discussion is, of course, on the topic of physical and mental health effects of COVID-19 and moving forward. I wish to welcome both our speakers this morning, Dr. Karthik Periyasamy and Rosen Kure. Thank you very much for accepting our invitation from the chamber. It's our pleasure to have you here with us in the event. Let me now briefly introduce the two ladies to you. Dr. Karthik Periyasamy, of course, she is a consultant physician, board certified in internal medicine and specialized in diabetes care. She's a member of the Royal College of Physicians and the American Board of Internal Medicine and the Ceylon College of Physicians. She is in full-time clinical practice and also the founder and director of Healthy Life Clinic. Apart from this, she also spends time promoting health and wellness to corporates and communities, as well as finding better ways to help our patients and public adapt to healthier lifestyle practices. And also Rosen Kure is a business and organizational psychologist. She's registered with the British Psychological Society, whose 14 years of experience comes from her work in Australia, UK, Abu Dhabi, and Sri Lanka. Locally, she has worked on projects for over 75 companies from various industries and is a published author from Crisis to Character and Rockstars, a certified coach, ACC. So welcome again, ladies, and let me hand over the presentation to Rosen, and let's take it from there. Thank you very much.
Thank you, Amanda. Very good morning to all of you. So we have about an hour to cover the wealth of material that we have prepared for you today. Let's begin by defining the times that we live in. This these times are signified by what we used to know as VUCA, right? The volatility, the complexity, the uncertainty and ambiguity of these times. It's so high that every day it's as if we need to sometimes change our plans. I'll give you an example. So sometimes the material that we covered last week on a webinar might be different this time because the lifting of the curfew, right? So this the funny, almost like I would say what we probably didn't expect, even the best scientists of the world, or the gurus or the pundits who couldn't predict this time, is that this time was the virus introduced a particular level of uncertainty that we were not used to. If it was war, if it was a financial crisis, we've kind of known this a bit. You know, the Spanish flu was way before our time, so we kind of didn't know how to react to this. So today, without further ado, I actually want to introduce you to a particular activity. If you have a pen and a piece of paper, I would like you to do a self-assessment to see where you are right now. So I'm going to project that image to you. So this is a very simple assessment of our well-being that you can use for our well-being. Okay, so in the core of it is 0 and then up to 100. So if you can take maybe half a minute to rate yourself physically, how well you are, emotionally, mentally, spiritually, financially, socially, family-wise, and environmentally. Okay. All right, with this, I shall come back again, but to cover the physical aspects of this time, this lockdown and curfew, and also post-COVID lockdown, I'd like to hand this over to Dr. Kayatri Periasamy.
Hi, good morning, everyone. Thank you, Rosane. So the physical part of this lockdown, it's not something we don't do on a daily basis anyway, but our physical health with these uncertain times, along with our mental health, can get severely affected because, you know, physical health and mental health always go together. So when they when one is affected, the other gets affected equally hard. So if you are constantly stressing about these uncertain times, you are going to have some physical symptoms, and you are going to have some illnesses that are going to crop up, and maybe more things can crop up over the in the future. We are not even only talking about the lockdown period. These sort of continuous mental stress can affect your physical health in a large way. And in the same way, if we don't look into both sides together, we might end up losing everything. So in my talk, I'll just focus on these few areas. I've put 4 pictures here. This is really to look at the 4 groups. And the biggest group, of course, is all of us who are actually healthy. The first group, where you can see the healthy people. And this is, I mean, COVID-19 affects many people. There's been many scary stories, but most of us are in this group where we are actually healthy. Then we have the special groups where, you know, the people who already have certain medical issues like diabetes and high blood pressure, and how this uncertain times affect them in a greater level, and how COVID-19 would also affect them in a greater level. And then the other special group that we need to pay close attention to are the elderly people, elderly in our families. And then lastly, I will just talk about, as we move away from this lockdown, you know, the big question in our head is, are we going to get COVID-19? So first of all, looking at all of us, who are healthy right now, this is a nice diagram which just projects, it's how COVID-19 deaths compare to other leading causes of death, especially in the US, this diagram was taken from. And here you can see that in yellow, you see the COVID-19 projected deaths between 60 to 240,000, because we don't know how much more deaths may occur over the next few months. But if you look at other things around it, like such as suicide, drug overdose, Alzheimer's disease, strokes, cancers, and heart disease, you can see that many of these diseases that have been around is still around, and it's much bigger than COVID-19, and we are more likely to get those than COVID-19. So whatever we are focusing on for our health, we need to focus on making sure that we don't get ill from something else as well. And that's what we are most likely to get, right? So if you take Sri Lanka also, the causes of death in Sri Lanka, I mean, every day people are dying of heart disease, strokes, diabetes, road traffic accidents. I mean, these are in millions, and it's over 1 year. I mean, still 1.8 million Sri Lankans are dying of tuberculosis. So these are huge illnesses that we are faced with on a daily basis, and things that we can do something about. And whereas COVID-19 is something very new, very unknown, not affecting such a big group of people, but it's new. And so we worry a lot more about that than all these other things. So during this time of lockdown and going forward, I actually see a lot of health opportunities for our physical health, because during the lockdown, we have something called time, which everyone who these are the things that we don't have. No time to eat healthy, no time to do the exercise, no time to sleep. I'm so stressed, I need to smoke, I need to do this. So time seemed to be the sort of enemy when we are trying to take care of ourselves. But that's something that we had a lot of in the last 1 month. Maybe going forward, we may not have so much time, but at least we need to know what to do so that we stay healthy for many reasons. One, to avoid COVID-19, because doing healthy things boosts our immune system. And of course, doing healthy things keeps us healthy from all the other diseases that can also adversely affect our health, right? And also doing these healthy activities and keeping our body healthy will keep us in peak performance, both physically and mentally. So what are those things that are known to work to make us healthier? Everyone knows this. We need to eat healthy, we need to exercise, we need to keep physically active, we need to sleep adequately, and we have to avoid putting toxins into our body, because there is enough pollution in this world. We don't need to, individually do things like this, right? So these are things that everybody knows, but do you know that scientifically this is all proven to improve our health, proven to reduce the risk of getting heart disease and diabetes and high blood pressure and even cancer? So these are the 4 things that you need to focus on to get yourself physically well. And the important thing is that you create your own health mantra, which is sustainable, which is easy to prepare and execute and continue even when you get busy. So it's like almost like autopilot, that you do these things even at the busiest of time, even the most stressful of time, that you can clearly follow these healthy habits. I mean, you don't have to do everything all the time. Nothing is like that. But what I'm saying is, these healthy habits, if you have it in you, you will find that even if, going forward, if you're not able to eat at home every time or eat the most healthiest food every time, but if most of the time you do it, that is helpful enough. And that's the thing that we need to get into our minds, that there is no secret recipe that you can just follow, and there's no secret ingredient that we can just take every day to get our health in good focus. We just have to do these 4 things on a regular basis, just like anything else. It's like bank savings, right? I mean, you need to put in your little 2 cents every day to create your healthy bank balance. And just like that, you have to do these 4 things on a daily basis to get anywhere. So like I was saying, this is basically a recap. When you do these things, you are healthy now, you boost your immune system, you prevent future illness, and you keep yourself in peak performance physically and mentally. And of course, everybody knows, going into the hospital just empties your bank balance. So this is one way of keeping your bank balance good too. Another health opportunity that I wanted to just let you all know, this is very, very important and very of note, is that dengue we are very familiar with, and we've had dengue for many years and we can't seem to eradicate it. And it is also a viral disease, just like COVID-19, but it's been around for longer and we've got familiar with it. And every year, so many of our Sri Lankans die from dengue as well. We've had 100,000 cases, more than 100,000 cases last year. And every month we get somewhere between 5,000 to 15,000 cases, depending on the rainy season, etc., etc. And interestingly, even in January and February, we had huge numbers of dengue cases. But in March, we had only 200. And I think in April, there were only about, so far, very few cases, like 11 or something in Colombo. So just see that, I mean, it is about people, right? I mean, less people movement, less constructions maybe, less stagnant water activities and things like that. So we really need to think that we can, I mean, over all these years, we couldn't get our dengue numbers down, even with all the cleaning and whatever we do campaign. All we had to do is stay at home and, don't pollute the environment, and we are able to even get dengue down. So what I'm saying is, we need to go, as we go forward, there are a lot of things that we need to rethink how we do. And these are the health opportunities that has occurred during these difficult times also. Again, now going to the next group of people who already have pre-existing medical conditions. What do we mean by these pre-existing medical conditions? These are importantly high blood pressure, diabetes, heart disease, and lung disease, and cancers and kidney problem. These group of people, it's quite common. I mean, in Colombo, you can say 1 in 5 people have diabetes. So, but the thing with these kind of diseases, it's controllable and it's in your hands and you can really keep them under control. And it just requires time and attention, which we have had a little bit of in the last 1 month. So going forward also, even people with health conditions need to look at those 4 things I talked about: eating healthy, physical activity, good sleep, and also avoiding unhealthy habits. And this will keep them in control. They need to be able to sharpen their health mantra and understand what kind of targets, what should their blood pressure be, what should their blood sugar be. And this is a time they can fix all this. They can talk to all their physicians over the phone. Now this past month, the physicians have been all available over the phone, and perhaps get all these things in order so that going forward, we have to be aware that people who have pre-existing conditions fare poorly when they get COVID-19. They get more severe symptoms, they get more complications. So if these conditions are under good control, there is a better chance that they will get over this COVID-19 also, right? And it's important also, this particular time has also created some health awareness in everyone, in the sense, we can't just buy medicines whenever we like. If you are on medication for pre-existing medical conditions, you need to be careful and prepare ahead and keep at least 1 month's supply with you. I mean, we've seen this over the last 1 month, how people had suffered in trying to get their medications on time. And this should not be so, because medicines are available and we should be well prepared. And it's also important to note, during this lockdown period and people worrying about COVID-19, some other things have been happening for people with pre-existing medical conditions, where they have delayed seeing their doctor because for various reasons, for a chest infection or a chest pain or an infection anywhere, because they were scared to go to the hospital, or they just couldn't get to the hospital because of the lockdown. And studies are now showing that people are actually presenting to the hospitals late with delayed heart attacks and things like that. So we don't want COVID-19 problems to become problems in other health problems. So this is something we need to take note of. And then going to the next sort of vulnerable group is the elderly. Again, we talked so much. I mean, you must have heard a lot about this elderly people where they need to be protected because they have pre-existing conditions. They're frail, their immunity levels may be lower, and it has been shown that they don't do well at all with COVID-19. And if you look at this bar graph, all it shows is, according to the ages, from 0 to 9 years at the top to 80 plus years at the bottom, and the different colors just denote different countries: South Korea, Spain, China, and Italy. And everywhere, even UK and US, they have noted that as the patient gets older, their chances of surviving COVID-19 is getting smaller. So where the case fatality or the rate of death with COVID-19 is about 0.6% overall, but if you're older than 70 years, your chances of dying from this is much higher, like close to 8%. So it's very important that we protect our elderly. Even as we go out, there's no reason for our elder family members to go out at all. They should be protected. Their supplies and their needs should be looked into, and their mental well-being also should be looked into. And now we have many telemedicine platforms where the elderly can do their routine visits through telemedicine itself, and for very few reasons only they will need to go out to see their doctor over the next few months, I would say, right? So now the last bit, I just want to concentrate on this next question: will I get COVID-19? Because we are going to open up, and I'm also surprised that we've got a date on the 22nd. So everybody is excited and also apprehensive, because all these days we were safe at home, we were sheltered at home, and we couldn't possibly get COVID-19. But what happens when we go out? Studies and observations have shown that only 80% of those who actually get COVID-19, 80% of those people who get COVID-19 are actually they have actually had prolonged close contact with someone with COVID-19. So if you've not had a prolonged close contact, the chances of you getting COVID-19 is rather small. And also the good thing is, in our country, community transmission is still not happening as we know it. There have been few clusters and villages with COVID-19, but it hasn't really spread into the community in a big way like the other countries. But however, this is hard to tell, because at the beginning of your illness with COVID-19, you don't really have much symptoms, and without knowing, you could spread to others. So when we go out, our actions determine the answer to this question of will I get COVID-19. Everyone needs to have a plan on how you're going to do this. Not only do countries need exit strategy, every individual will need to have their own plan. And one statement I had seen was very profound, and this might help us get, help us to make sure that we don't get COVID-19, is when we go out to act as if we already have COVID-19, rather than just keep on worrying, am I going to get COVID-19? Because the way we behave when we have COVID-19 actually is, it's good to prevent COVID-19. So let's look at that. How do we prevent? Each of us must have a home exit kit. This is just something that I wrote, but you could name it, have your own names for your exit kit, or whatever you want to call it. And then you must have a plan on how you behave when you come home from outside. So your exit kit should always have a mask, and this mask does not have to be a surgical mask or an N95 mask. You can just have a scarf, a handkerchief, a cloth mask, whatever it is that you can reuse, it's fine. Unless you're going into a hospital, then you might need a surgical mask, and most places they provide you with one too. So that is important. You need to know to keep a distance wherever you are. If you're going to an office, between the person in front of you, on the side of you, in the back of you, there has to be a meter distance so that you're not in touching close contact. And don't decide to do a group selfie or something like that. Don't get close to anyone. Keep your distance. It's not yet that time to do group selfies yet, right? And stay home whenever you can. Just because the lockdown is over doesn't mean you need to go out. Just see, is there a reason for you to go out? If you have to go to work, yes, go, but you don't need to go anywhere else. And those who don't have anywhere to go don't need to go window shopping or anything like that. We still have delivery systems. So think carefully about whether you really want to go out. Hand hygiene is very, very important, and wash your hands frequently. And important thing is when you're outdoors, don't touch your face. And when you come back home also, you need to have a protocol. You have to have planned it. Leave your footwear outside. Leave all the things that you're bringing outside or on a table that you have designated for this, where your kids can't get at it. And go head straight to the bath, wash your body, your hair with soap and shampoo. Soak all your clothes that you have worn into the laundry detergent, and you can wash them together with the rest of your clothes, but you need to get them washed. Don't leave them hanging anywhere. And then get back to the things that you have brought and sanitize them and the footwear before you bring anything into your house. And only then you can hug your kids and your family. And this is something that the whole family has to come to an agreement as to how you want to plan this. So this would be my sort of advice for going forward. Keep yourself healthy with the 4 things. Keep your health mantra going. If you have any pre-existing disease, keep them in good check and safeguard your elderly, and have your own exit plan and home return plan. And at any time, if you have symptoms, do not hesitate to call your doctor first. Thank you. Hussein will take over from me now to talk to you about all the mental health issues, the stress of being in this sort of situation. Thank you.
Thank you, Dr. Khatri. So as Dr. Khatri was saying about, especially the last slide, about the physical distancing, at least a meter as we go back to work, one of the things that crossed my mind actually was in anthropology, they say that what made Homo sapiens survive against Homo neanderthals was the fact that Homo sapiens were living in groups. They learned to live in groups and fight their enemies in groups, and that gave them a better survival chance, and that is what helped them cope with a lot of crisis. Now, this is probably why sometimes we have this urge to go out as well, because if you even look at the especially the collectivist societies, during crisis we are really good at helping each other. We reach out for help, and it's almost a given that your family will come to support you. But during this time, it was actually reversed, and we were asked, if you love your family, you really need to keep a distance. So this does not naturally come to us, right? So there is a form of distress, stress that comes as a result of this. That is one. And the other thing is, I spoke about uncertainty before, and largely the uncertainty also comes from the fact that no one actually knows where we are in the curve right now. Are we just starting at the bottom, or are we in the middle, or are we at the end? So this particular uncertainty has also brought about other uncertainties. For example, employment, salary cuts. And the fact that you have a huge family to support, but you might not know whether this job will be there in the long haul. So all these stresses, we are processing that at the moment, and that is not an easy thing to do. So I will hopefully be able to touch on the different areas that you have assessed. Now, let's see why this was a difficult transition for us. See, pre-COVID times, in the family, we all had a system. So in this particular system, the system had an equilibrium, a particular balance, right? So there were expected roles that particular people played. So the husband knew what to do, the wife knew what to do. If you had elderly parents, it was expected, and these roles were fulfilled in some way or the other. And what happened now after this, when we brought work home, is that this intricate balance of the home front was disturbed, right? And that brought in a lot of challenges, especially to the people who are running the home fronts. But these are actually the people that usually the mother or the father in the house, or the person who supports the elderly parents. And I also want to mention a little bit about people who live on their own as well. I shall do that later. Now, when you brought that work home, this the issue of time, so doctor mentioned before that we have the privilege of time. Yes and no, and that's because now we have to rewire our brains as to how to prioritize what's important, what's needed, what's urgent, and what's not. And that process takes a bit of time, because all of us take a bit of time to be acquainted to this balance, right? And why we are feeling sort of probably stressed, distressed, frustrated could be because of this. Now, I want to reiterate at the very beginning, whatever you're feeling right now, be it boredom, anger, a sense of fear, all that is valid, right? There is no such thing as during a transition that I shouldn't be feeling like this. No matter how strong you are, all of us as human beings, at some point, we are challenged emotionally. And these are actually good things, because we'll talk about resilience later. Because if we are not disturbed emotionally, we cannot grow in our resilience. So this can be an opportunity for our own personal and emotional growth and hardiness. So going to the environmental well-being aspect of it, some of you might agree with me, because I am challenged by it. Bringing work home is pretty tough for people who have kids. Currently, I'm actually doing this from my bedroom. Someone is occupying the other rooms of the house, right? But one thing that we agreed about a couple of weeks ago, when this became a bit chaotic, is that we all said, okay, this is our timetable. This particular room is occupied by this person from this time to this time onwards. And especially if someone is using the bedrooms, after you do what you have to do, you have to pack all your office equipment, computers, books, or whatever it is, and it has to be put away, because usually bedrooms are for sleeping. Okay, and that particular system has to be maintained in some, so you have to be very disciplined in that way. So I'm also hoping, even though the lockdown is eased, that going forward, most of us will work from home at least a majority of time. So the environmentally, another thing is that not all of us have huge living spaces. Sometimes our living space is small. We have kids, and we have, maybe even parents, but you also have to now carve out a place where you need to concentrate and be productive in. So if you're an employer, keep in mind that these are some of the things that you need to consider and be mindful of about your employees. Okay, this is a really good time for empathy. It is also a good time to sort of even come back together as a team and ask this question, okay, can we function the same way, or should we put new set of ground rules? And say, for example, if you had flexi hours before, right? Now, just because you're at home doesn't mean sometimes those flexi hours don't work, because there was a reason as to why you asked for those flexi hours. So to be able to respect that, even during that time, this is the time maybe a particular person is with the kids, or I mean, in certain cases, new mothers who are, who are actually nursing their children. So, but in the core of all this is actually communication. So as a team, you got to come together and put a new set of ground rules as to who's doing what and what's to be expected and what should we not expect, right? So we got to be disciplined in terms of when we are checking our first email or first WhatsApp message from work. So as we wake up, if we are to check our phones, okay, so you're starting work pretty early. So imagine if you're waking up around 5:30 or 6. So your brain or your mind starts working from that time onwards in terms of work. That's actually not quite fair, because before COVID-19, we had a time to get dressed, have tea, go out and, to travel. So all that time is, so you got to ask yourself, what are we going to do with this travel time now? Now that is being released to me. Okay, what am I going to do that will add value to the system or to myself? Another thing when it comes to working in teams is that during you have to take breaks. Okay, sometimes I have this tendency where I drink a lot of tea. But sometimes the fact that the cup of tea is there and it's visible, I feel that I am actually having tea. Like I feel unconsciously it's telling me, okay, you have tea here, but the tea is cold. I haven't taken more than 3 or 4 sips, right? So you have to be very disciplined when you're also at work, to take small breaks. Just go out and do something that energizes you. See, what again we don't have now is that we don't have each other to motivate us, right? Like usually at work, we were sharing the same physical space, but we don't have that anymore. So we also have to find ways and means of being or staying motivated. At a given time, we may go through different sort of I would say the different levels of maybe like systems, right? So there is a drive system. So drive system is where we feel really motivated. We feel that we are doing something great. The creativity is great. We make great decisions. But there is also, which opposes this, is the threat system. Threat system happens when there is a perceived threat. In this case, it's the uncertainty due to COVID, right? So and so because of that, emotionally, we might not be in a place to perform at our optimum. And this is something that you need to be aware of yourself as an employee. But if you are also a manager, you need to remember that, because sometimes when managing people's workloads and getting them to fulfill a particular task, sometimes why they are lagging behind could also be because of this battle between the threat and the drive systems. Then of course there is a more calmer system. This is a system that that governs when we are relaxed, or when we go to sleep, or when we meditate or pray. But that is the system. So the karma system is what usually brings a balance into our in us, within us. Okay, so let's see what else we could do with regards to that. So emotionally, um, if we look at how we cope emotionally, now usually research over and over again emphasizes the sort of importance of people relying on a belief. And this is because it's one of the strongest coping mechanisms. So be it a faith, be it a philosophy, it is something that anchors you. It is something that gives you meaning. You ask yourself, why is this happening? Why is this happening to my family? Why are we to lose a job? How are we going to reorganize ourselves? So to go back and look at it from a different perspective, from the perspective of a faith or a belief or a philosophy, really helps. Now, recently I read an article about the importance of helping children cope through faith and belief. right? So this is once again a very important segment in coping. So use of belief and faith. Secondly, uh, affect. Okay, so I'll give you a small acronym: basic PH. So B is belief, A is affect. Affect is actually your emotion. So sometimes when we are sort of maybe confined to a smaller place, or when we are working and we are not motivated, there are different emotions that we go through, and sometimes we don't know how to cope with it, right? Sometimes we would want to cry, or sometimes we want to be left alone, and there you really got to accept and embrace that emotion, right? If you run away from it, we what we are doing is we are just sort of brushing something under the carpet, right? And we can't do that, because that is what's going to make us ill. Doctor mentioned many things that actually do kill us, and one is also the NCDs, the non-communicable diseases, the diabetes, the high blood pressure. Without us knowing, stress can really creep into it. Now, even before COVID, stress was the #1 killer in the organizational world, right? And but it manifests in so many different ways. So it's important, whatever the emotion is, that you find a way to let it out. So if you want to cry and need some personal space, and if the washroom is the only place that you have with some privacy, that you can really cry out, and you could do that, right? And at the same time, ask yourself, what sort of music would you like to listen to during this time? Do you want to speak to a friend? So things like that you need to include into your agenda. And the next one would be the affect, and then I would also say the negative ways of emotionally coping. You could throw things, you can shout at people, you could really hurt people. Maybe it's one or two words that you say, but it crushes that person. So we need to remember, this is the importance of emotional intelligence. Take a step back. I would say even take half a day if you can. The people who can afford that half a day, but the people who can't, try and get small pockets of time where you actually do reflect about how you feel, what sort of a person you are, how in the past you have dealt with crisis, right? So emotional intelligence requires you to be really aware then and there. So what am I feeling right now? And then asking the question, why am I feeling this way, right? Who are the people around me? What were the words that were mentioned when I actually felt this way? So you are bringing to your conscious mind the environment in which you became really angry. Say, for example, anger, if you take the example of anger. So once you identify that you're angry, we also need to find a way to regulate it. Okay, so maybe instantaneously you would want to retaliate and say something to destroy that person. But what if you take a step back and say, hey, I'll let him win. That's fine. I'll let the kids mess the room. That's fine. Okay, it's not a life or death situation. I'm going to take a step back. I'm going to go out, or go to the washroom, or go to a place where there's nobody, right? And there you do something that really helps you to calm down. And for some people, it's breathing. Breathing is a very powerful technique of emotional regulation. Okay, maybe prayer or meditation for a short time. Okay? And being mindful. A lot of people think that mindfulness is actually, meditating for a longer period of time. No, mindfulness is bringing your attention to that moment. Right. So if you're eating something, to be aware of what's there, to taste every vegetable or every dish that's been served, and to really enjoy that, and to eat slowly, right? So that brings a level of awareness as to what you're doing at that time. So it really helps in your emotional regulation. And this form of intelligence also not only helps you, but it also helps to understand the other person. So, for example, you could later, when the person who made you angry, if they're in a good mood, you could also say, hey, you know what happened this afternoon? That's not what I meant. And I felt you were really worked up, and if they are ready for that sort of conversation, it's easy to help somebody else understand that particular emotion as well. And that's really important in our relationship management, especially during this time. If you are a parent, I urge you at least 10 minutes with every child of yours. With each child, if you can spend 10 minutes being present. And being present means it doesn't mean doing things, right? It just means being with them. Maybe they're watching some cartoon that they like. Sit with them. And if they're younger kids, take them to your lap, embrace them, and be really interested with them about what they're watching, right? And this is the conscious parenting aspect of it that really that enriches the emotional development of children as well. And I think if we plan it well, we have a good opportunity to do that as parents. So now we covered BAS. S is social, and now this is, we need to keep physical distance. Usually we also cope with we reach out to people, as I mentioned before. We need people. And some of us, when they are upset, they like to talk to someone, call someone. They would have on the on Skype or on Zoom. They will share a meal and things like that. So you surround yourself with people even virtually. And but there are some of us, when we are upset, we withdraw. There is nothing wrong with that. If that is the way you dealt with crisis before COVID, you can continue to do that, right? Because not all of us are geared the same way. So I is actually imaginative. This is also a really good time to learn an instrument or start writing and painting, things that maybe you always like to do, or you never thought that you'd like to do it, but you're now starting to do that with your kids, and you realize, okay, there's something in this for me as well. So to pursue that. And what if you really look at historically, people, the greatest artists of the world, the writers, the painters, the pianists of the world, the musicians, they produced best of their work during times of crisis and depression. Okay, so that says something. It says that we have the capacity to convert a very negative energy within us into something constructive, right? So I also invite you to introduce this to your children and your family, and to get the creativity going even as a family. This also applies to teams as well. Mentally, okay, you may have heard this before, but we have to be very careful of the amount of news that we expose ourselves to, because today, whatever the news channel, whatever the paper that you're reading online, that it introduces quite a bit of negative information. It's a death toll, or it's something or the other that is actually negative. And so we need to have a control over how much of information that we put into our minds. Secondly, social media. Now we, especially the Y Gen and the Z Gen, these generations were they do feel the need to do things. They feel that if I don't do this, maybe it's on my part a failure. So impact on the environment or for a cause is really important for these two generations. But if you are a part of this generation, and if you do have this urge, tell yourself, no, it's okay. You don't always have to do things, right? Now, what happens with you can relax and actually maybe take a stock of your life as to where the direction of your life. Now, with this generation, another sort of a challenge is that they feel that their friends are updating things on Facebook about maybe a charity project they did. They fed this many number of families or things like that. Actually, you don't need to hear that. And if you feel that by hearing that rather than you getting motivated to do something good, you feel bad that you're unable to do it or you don't have the energy to do it, don't go on social media. So mentally, you can also maybe learn a new language if time permits, expand your vocabulary, write, do puzzles and things like that. Spiritually, once again, now, again, I go back to how I started this about uncertainty. If there's one thing that defines our time is uncertainty, right? And how do we then equip ourselves to face this reality, right? And there is only one answer. The inner man within us have to be strengthened, right? And that is different for different people. The way you strengthen is different for different people. Now this is exactly what we call resilience. So spiritually, to be anchored to something that you know is the truth, right? For you, that's the truth. It could be a philosophy, it could be a religious ideology, it could be the faith in God, but whatever it is for you, it's the truth, right? So to be anchored and to be certain that whatever happens, this rock, the waves might vary, it might come and go, you might shake, but the rock won't shake, right? So that is really important to keep in mind. So once again, as I mentioned before, it's a good time to teach your kids the values and things that will really ground them. Financially, this is going to be a tough time. Recently, I read an article where they're saying that this is going to be much bigger than the financial crisis in 2008. Now, during financial crisis, one of the highest suicide rates were reported in Japan. And that was when you answer the question as to why. It's also because the work ethic of Japan and also the work itself is a huge part of a person's identity, especially males, right? It's like who I am is also what I do, right? So when that portion is taken away from you, the question of then who am I? That huge emptiness comes to people's is created within people. So to also remember this, right? Yes, things come, things go, times change, but who am I won't change. Who am I is not what I do. It's not my job. It's not my titles. It's not the car I drive or the house that I have, right? It's not. It's so if at all, if there's something that I would want to do, it would be to become hardier to face the crisis better, right? So to remember that is really important and to live within our means. So for example, if you feel that your job is at stake, and also there is a pay cut now that, with a smaller pay, you have to manage much more. And then there is a loan to pay. I would say, first and foremost, sit down with your spouse or the stakeholders involved and work it out. Plan it. Plan how you're going to do it. Plan where you're going to cut your expenses from, right? I'll give you an example. Now, all of us, who are parents here, we want to give kids that we probably sometimes we didn't have and we also like. So I recently saw how a friend of mine on Facebook has posted this video on how the kid is learning ballet by watching something on YouTube. So we have to find creative ways through which we can still give that our kids that privilege, but probably we might not be able to afford what we really want our kids to have. And in a way, that's okay, because we also saw in the last decade or so what spoiling has done to kids, what giving too much has done to kids. So this could also be an opportunity to moderately manage what we really give kids and sort of spoil them with. There is another one, that minimalistic lifestyle, and also to if there's something like to be more self-sustaining. So, for example, if there's something that you can grow in the house, and to really plan that and to do that, it's also quite fun, and it's another creative activity in coping. Then also to remember people who are stressing here about children not going to school. Going to school is only one form of learning, and every minute that they are in school, they are not learning, right? There are other things that kids nowadays really need, the life skills. Okay, so things like cooking. Can your kid stitch a button into a shirt? Things like even having your own vegetable patch and looking after that. So those some of these really important things in life, this is a really good time to teach them and to give them ownership to grow something, to look after something as well. Okay, so in the coping, we covered BASI, that is the imagination. C is cognition. Cognition is how we think, right? If we change the way we think, it's easier to look at everything from a different perspective. Easier said than done, but eventually we could get there. For example, and now you changing your thinking is just not enough. We need to also help our children change the way they think about things, about objects, about materialism and things like that. So for example, maybe there is an opportunity in, you losing the job. For me, it's very easy to say this, right? Because I'm just making a statement. But amount of people after 2008 credit crunch, amount of people who came and gave testimonies as to, losing that job really helped them in another way to become better or to start their own businesses and things like that. So there is always an opportunity in the crisis. And pH, BASIC, pH, basic pH, that's the physical activity. Okay, we don't have an excuse as to not exercise. Even in from our bedrooms, we can choose to exercise, and that is very important. That's because when we exercise, the hormones that are being secreted into our system is an antidote to the stress hormones. Like these are the cortisols. When they accumulate in our systems, these are the things that give us high blood pressure and diabetes and things like that. So as doctor mentioned, exercising at least half an hour a day will be very helpful. Okay. Finally, I would like to touch on the family aspect of it. This might be a really good time for us to define what's really important to us, as people, whether we need to reevaluate our values or whether we have lived according to our values, whether even our work and our lifestyles have robbed something that we believed in as children, the values. So I feel it's a really good time to ask this question. Is this very important to me? What are the things that I need versus what are the things that I want? And the things that I want, can it wait? Things like that. And we as organizations, the people who are leading organizations or managers, we need to be ready to redefine our business models, reimagine our vision mission statements, and also to keep in mind what really probably worked back then might really not work when we actually emerge from that wave on the other side. So the skills that we also need to inculcate in our children might have changed. So we need to pay a close, pay close attention to things like emotional intelligence, resilience in children, adaptability and flexibility in children, self-sufficiency. We need more and more employees who take self-leadership, who are self-disciplined, and those things. It's always good to keep that in mind, because that is what's going to actually help our children face the future better. I'm going to very quickly show you the last image. Hope you can see that. I want you to sit back and imagine your favorite movie and your favorite actor or the actress in that movie. Okay. So now, if you look at the chart here, or the graph here, there is an all equilibrium. So, for example, in your the person, your main character, when the movie started, there was a particular reality this person was living in. Like you knew his likes and dislikes and the people that he associated. So there was a particular balance in his life. And then suddenly you see in the storyline, a crisis takes place for your main character. And then you see your main character really striving to really make meaning of this situation and come out of it. See, there are many pathways we could take. So one is actually quitting. In gray, you can see that quitting. So maybe, committing suicide or completely letting go, losing hope. And in that case, the movie would end there, right? But there is also extended crisis. You see your main character doing same thing over and over again, expecting different results. So there is no go there, right? And it's pretty boring movie if that's the case. Then you also see maybe your character like partially recovering from the situation, but really doesn't go to the optimal potential that this person could go to. Right. So in that case, again, it's not such an inspirational movie. But why you remember this movie and why you really like this actress or actor in the movie largely depended on how this person, whether this person took that huge exponential sort of the leap to get into a new place, to get into a new height, right? To see things differently from a new perspective of hope. Right. And so why I wanted to bring this up, it's actually a model that I have researched here in Sri Lanka with my clients in the last 10 years or so. One of the things that we need to remember as we climb that mountain, that steep mountain, this is where our character grows, right? This is where we gain stamina, and this is where emotional stamina and also the hardiness to face difficult situations. So in this journey of life, like the movie of life, in your movie of life, you are that main character. So I invite all of you to really look at how you would like to act in this particular situation, in this particular crisis, and to be inspirational. Once again, thank you very much for the time that you gave us. And if there are any questions, Dr. Gayatri and myself will be happy to take. Thank you.
So if you do have any questions, you can please use the chat option that's right at the bottom of your screen. If you do have any questions or comments, please use the chat option to send us your thoughts so we can all see. Okay, so I guess that's it. Doctor, would you like to add any comments just before we end?
I guess it's important, I think, for people to note that, the mental stress that we are going through right now, it's intricately tied up with our physical health. So as we strive to get a new equilibrium, as Roseanne was saying, when you push yourself, when you look into all those health habits, that could be a ladder, a sort of a stable thing that you do that gets you across this crisis as well. Like everything else can change, but don't lose your health, because the physical health determines how well you're going to do in this new equilibrium as well. So, yeah.
Doctor, there is one question I think for you. Should work from home be mandated if possible, even after the curfew?
So we are in a new sort of a novel situation, just like this novel virus. We may be out of our lockdown soon, but like I was saying, there's no need to crowd. We can't crowd areas. We have to keep that distance for a little longer because we don't know what happens. There's been a lot of talk about a second wave and things like that. So it's always better to be cautious. And in this day and age of work from home, like we have a lot of communication ability, we have a lot of computer ability, all these things, Zooms and meetings. I don't know about mandated, but I'm sure we will find that a lot of companies will be asking part of their workforce to be working from home, whoever can do that. And whatever jobs that can't be done, then they will have to come in. And it may be a turning point in Sri Lankan industries and corporates where people might use this type of channels more. I was just reading today that in Sweden, they didn't do the lockdown, but their numbers are not extremely high like everywhere else because they were already, I think this is the country that has most number of people working from home anyway. So not that they didn't do anything, they were already doing these practices even before. So there are a lot of learnings from a lot of countries and even from our own country. So yeah, and there may be a lot of changes. Like I said, you don't have to go out unless you really have to do something for now.
There is another question. Can you see that, Doctor?
Yeah, so it says that given the death rates, should curfew discriminate on age? There are countries who are doing that. Even when they open up, they are asking the elderly to stay home. That is what the data is showing right now. But nobody has actually, again, put a sort of a rule that you can't come out, but it is the smartest thing to do, that we keep our elders safe at home and if they can be helped in any way with all their needs. Yes. So just taking that a little bit more, that in a lot of places schools are still going on, but they also say that don't visit your grandparents, right? You don't want the kids to bring it back home. Yeah, the next question is liquor distribution now okay from a health perspective? I think in this crisis, the people who the health sector has relied on incredibly is the general public. We have relied on their ability to listen to all these very, very strict, archaic rules. We have relied on them to use their common sense. And most countries, including ours, people have complied very, very well. So it is more about people using their common sense to, do what is right. Certainly in certain societies or in certain areas, we should be careful where you think that people think that they may not follow these orders. But again, it's very hard to discriminate that way. So yeah, it's a difficult question, and we don't really know. But I think we should rely on our people's common sense to decide what they want to do with the liquor situation.
Roseanne, there's a question for you as well. Roseanne?
Okay. So the question is, in the new normal, working from home may continue for a longer period. How do you suggest that people keep a balance as they won't meet other colleagues for interaction? Okay. So we have to heavily depend on technology. So sometimes we what we are going to miss at meetings would be actually the body language of people. So when we are making decisions, before, when people were in the same physical space, it was easy for us to understand them because it was not just based on words. So some of the little things that we can do virtually to optimize what we are doing, to always keep the computer at a level that that's directly in front of you, and maybe perhaps if you haven't done that yet, to paste a sticker next to the camera, so you're reminded to look at the camera and not anywhere else. Also to switch off your own image, because that can be also distracting. And also agree on certain things. So you can actually have tea together. Also ask about the families, how people are doing, how the kids are. So because these are things that we would do if we were to actually meet. And to also to have some ground rules. So, for example, agree to disagree. So now people can easily take offense virtually if they are not able to understand the other person. And as I mentioned, body language speaks much more than the verbal words. So to ask people, to tell people, look, if I say this, don't take offense. It's because of this. So agree to disagree at the very beginning. So they are not the best, but this is the best we could do given the situation.
There's another question for Roseanne.
Yes, question for me. We have many millennials in the workforce who may not understand the value of emotional well-being and mindfulness so much. As an organization, how can we better support them in this area? A very tricky question also, because this is a situation where it's almost getting them to unlearn certain things, because I think the way probably they've been also brought up and the exposure that they had sort of gave them this message that, you could have anything anytime you want to. So it was instant gratification. And also this well-being, emotional and spiritual well-being, it can wait, right? And a lot of people have also told this to me. It's like, if I don't have something to do, if I'm not being driven by ambition, then I adapt to nothing. So I would say, Shivanti, it's a huge unlearning process as well. So to maybe inspire them by stories, because this generation also want facts and figures by research. So whenever we are saying something, we have to back it up by research as to a emotionally better person, functional person would actually be a better leader. Something like that. So those facts have to be with you when you communicate that. A simple motivational talk will not really get them to change their minds. Okay, I hope I answered your question. Yeah, I have noticed that working from home has resulted in more work than usual. How do you suggest we maintain a good balance between work and non-work, especially given the current restrictions? Yes, it boils down to self-discipline and assertiveness. So, for example, if you do have a difficult manager, you need to be able to really tell the manager the difficulties at home and say, I can dedicate this time from this time to this time, and I will do my best during this time. But these are my difficulties. And if you're a manager, you also need to be able to see the person's situation from that person's shoes as well. So this is it's basically completely taking us and putting us into a different planet of working. And so to be able to really empathize, if you're a boss, right? If you're an employee, to be assertive, not unreasonably, but to really say, well, this doesn't work. Can you suggest something else? And also, this is also a very important time for us to look after each other. So if you have a team member whom you feel who have 3 children or have elderly parents, looking after elderly parents, you could personally text them to see how they are doing, right? And these times, once again, we have, as a species, we've been able to survive this long because we looked after each other. Don't let physical distancing stop you from doing that. Send a text message. Okay, another thing that I usually also encourage people is in the morning, if you're working from different rooms or different, some people have a view, so they would take a picture and then put it on the WhatsApp group and say today's morning view, and everyone has to actually do that in a way. So that they start off with on that common note. But answering your question, assertiveness and a lot of self-discipline. So as I mentioned before, don't check your messages early in the morning. And if you tune off at 6, you don't check your mobile till next morning. And that you have to be clear about yourself, and you have to communicate that to your team if your job doesn't require to sort of be on call.
I think let's that is the last question we have. So ladies, thank you very much again, Dr. Gayatri, Roseanne. Thank you very much for your time, and we are already receiving so much of positive comments on today's webinar, and it's absolutely a mind refresher, especially during this time where people are having so much of uncertainty, as Roseanne said. I think this time would be the best to reflect upon ourselves, to spend more quality time and recover in a better note. We have one question, if we can answer that too, just to finish off. So Roseanne, would you like to answer this question?
Don't you think that the behavior of media personnel will affect the mental health of patients as well as connected parties? Of course, it's the media has governed our lifestyles, governed our even perception of what reality is. And this is why I mentioned before, you have to be very careful as to what you're watching, how much you're watching, right? Because they can people can catastrophize a situation, which means like making it look like it's such a big deal. They can also generalize things, which is also not fair, because I think all of us are different in the way we respond to a situation. So this is a good time, as I mentioned before, to always, whatever the media says and how they portray themselves to be, take it with a pinch of salt. Also cross-validate it with something else, so that you know that it's a better picture. So read also international news. We also need to know that, because Sri Lanka bouncing back is not enough, right? Because of our interdependencies in the economy, we need the whole world to bounce back to get into some sort of normalcy.
All right then. So that will be the end of this webinar. And thank you very much once again to both our speakers and to all the participants today. And have a pleasant day, and we'll see you all outside, and we'll get back to normalcy very soon. Thank you very much again from the chamber, and we'll hope to do more of these kind of sessions for you in the near future. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.